Welcome to today's webinar, Practice Building Secrets for Successful Functional Medicine Practitioners, brought to you by Diagnostic Solutions Laboratory and presented by Dr. Kalish. Welcome, Dr. Kalish.
Thank you very much. Glad to be here. All right, so today, this is a new talk I don't think we've ever done before, which is on practice building secrets that connect how lab tests are really the foundation of the clinic, the foundation of the clinical model, and how you can turn lab tests from something that might seem like an expensive burden into something that's an absolutely necessary, important driver of your success in working with patients. Absolutely. And so, my teacher used to say, your patient programs are only as good as your laboratory data. So the success of your patient programs is predicated on the quality of your lab data and your ability to interpret it. And that's kind of the business tip of the day, right? Is you got to learn this stuff. So for those of you that haven't run across me before, I'm Dan Kalish. I've been involved in functional medicine since 1992, which makes me kind of old. I've trained thousands of doctors in how to set up practices. Lab interpretation is my main interest, but we do a lot of business conference stuff, a lot of business seminar stuff too. And I'm really quite interested in the lab testing. And so Diagnostic Solutions, I know Dr. Brady and Tony Hoffman, I've known them for decades. In fact, we were at a conference earlier in the year, and I walked into this dining room, which had the scientific advisory board that was meeting. And I was looking around the room, was like, wow, we've been doing this for a long time. We've been at this for 30 years, all of us, the people that run this lab company, the doctors that do the trainings. And what we're seeing now is the most exciting time we could ever imagine, which is a really broad interest in the area of functional medicine and functional testing. So I can't tell you how excited we all are, the old timers are, to see the interest in the work. In Diagnostic Solutions Lab, you can't really say anything other than it's one of the best in the industry, if not the best. So we're really always proud to be working with them. GI Map, kind of innovative. We can't even say enough good things about the test. We'll look at some examples of that. They've also put together food allergy testing, and of course the omics test, which is up there before, and genomic insight. So they have a whole bunch of things going on. At the Kalish Institute side, we have our Business Essentials Boot Camp that's coming up in February. If you're interested in joining, you get 20% off if you use that code there. And we offer this class usually once or twice a year. It's one of our more popular courses. If you're interested in building your business and you're at a point in your career where you're starting a business or you're wanting to grow the business, this class can be super helpful, and you get 20% off if you do that, okay? And then in terms of what we're going to talk about today, I want to go through these slides and talk through some of the principles about testing and how it fits in with the clinical model and the business model. And then I'm going to show you a couple of example cases just so you can get a little bit of familiarity with the GI map test if you're not familiar with it already. And maybe we can even peek at an omics panel just for fun, okay? So this class is for practitioners who are interested in ordering their first set of tests. And you need to be able to explain the value and the purpose of the tests, but maybe you haven't done 3,000 patients already, right? Maybe you haven't had the experience yet to really understand how all this stuff works. And so what we found is that if practitioners order 3 to 5 tests within a month, you get over that hump of the lack of confidence in how this whole thing's going to work. And then in terms of how the interpretation part goes, we have classes, the lab company has support people. There's all kinds of folks out there that are going to help you interpret the labs once you get the results back, okay? And I think if you understand the value of the labs, then it's much easier to explain the value of labs to a patient. And learning the value of ordering the labs, sometimes some of this is kind of counterintuitive, some of it's kind of obvious. So I want to go through all the different points. But if you can explain to a patient why these labs are important, patients get it instantly. They want them, and you should get to the point where 90–95% of the people that you talk to are enthusiastically wanting to be tested because they understand the value of the test. And if a patient doesn't understand the value of the test, they're going to question whether it's really worth doing. And so the really, really essential questions are, why do we do lab testing in the first place? What's the point, And who do you test? How do you order these? There's some logistical issues. How do you convince patients to do the test? And then what do you do when the results come back? So we're kind of starting off with the initial essential questions. Probably not going to answer all of these, but the why to do lab testing. Lab testing is the most essential way that you're going to get information that's going to allow you to help that person with the root cause of their problem. And in terms of who to do a GI test on or an omics test on, in my practice and in all the training programs that I lead at the Kalish Institute, we test everybody. And in fact, if you just look at today's classes that I taught earlier, 52-year-old man, executive, super healthy and fit. His dad died in his 50s. When his dad was in his 50s, his dad died. He's a little worried about dying from a heart attack. He ran a GI map and an omics test, and we interpreted those today. The guy was in great shape. The lab looked great, and he's just doing it on a preventive health basis. So you can use these labs to prevent problems. We had a 2-year-old kid, baby, I guess, 2-year-old baby in class this morning as well that one of the doctors presented. And this 2-year-old baby was in and out of emergency rooms, severe abdominal pain. No one can figure out what's going on. It's going on for months and months and months. Kid can't sleep, parents can't sleep, you know, getting kind of to be a little medically desperate. Ran a GI map. This is a true story. This just happened a few hours ago. Ran a GI map, H. pylori, Giardia. And when we were talking with the doctor who's treating the patient in class this morning, she's like, you know, we didn't even get the test back, but I put, you know, the child on some probiotics and the pain's already gone. So we're like, okay, well, what's going to happen when the H. pylori and Giardia are going to go? And then we're going to, you know, get to the root cause of the problem. So you can test 2-year-old kids that are in and out of ERs. You can test 52-year-olds that are like physically fit but just don't want to die young. You can test women who want to get pregnant. You can test anybody of any age with these panels. And the more people that you test, the more you're going to realize that, you know, it's essential to do these tests on every patient. And how you communicate with patients is really going to determine how excited people are about doing all that. Okay. So when I think about, you know, what really makes a successful practice, having some kind of focused approach. And in my practice, I always worked with what I call the big five, which is fat, fatigue, depressed, female hormones, and GI problems. Okay. And those 5 complaints are really what I focused on for the first 10 or 15 years of my practice, helping people with fat, fatigue, depressed, female hormone, or GI related problems. That's a pretty broad market to go after. I found that lots of people had those series of problems, sometimes all 5 of them at the same time, and that functional medicine was really straightforward and easy to correct those conditions. I have other students in our courses that are just working with kids, just working with older adults, just working with professional athletes. We've got one kind of fancy pants doctor. He just works with professional tennis players. That's his whole market, so to speak. We've got people that just work with Hashimoto's, people that just work with GI cases. You can have a general practice as well, you know, if you want. But you do want to be clear in the group of people that you want to help serve so that your website and your materials and your explanations can all be geared in the right direction. You also then want to have a reproducible model. So you want to have a way that you can explain the work that we do to patients clearly. And we're going to go through my GI description model in a moment here so you can see, because as complex as functional medicine is, and as much as you probably know about functional medicine, you really got to narrow it down when you're describing these things to patients so it's easier for people to understand what you're actually talking about. And then all the successful practices I've ever seen are mostly fueled by referrals from you getting great results with your patients, and then those patients wanting to send in their friends and family. You don't really need to do marketing. You don't really need to be doing anything complicated to drive your business if your results are outstanding, okay? And as we're thinking about practitioners and how they distribute their time, almost all of us put all of our time into our patients, which is understandable because that's what we're supposed to be doing. But I also want to just point out that if you do that and you neglect your own self-care, then eventually you're going to burn out, usually around 10 or 12 years into this adventure. If you don't take care of yourself and your own physical body, your own mental health, your own sexual health, your own spiritual health, your own emotional health, your own relationships with your family and friends, your own sense of, you know, good, healthy diet. If you don't take care of all that, then 10 or 12 years into this, if you only focus on patients, you're going to fall apart and you're going to run out of steam. And then your practice will fall apart and then your patients won't have you anymore. So as the saying goes, you're the most important person to be looking after. And it takes a lot of time. Like if I look at the crazy things I had to do today to take care of myself. Okay, I woke up around 4:45 in the morning. I did a 20-minute sauna, about a 3-minute cold plunge at 45 degrees, which is really cold if you're wondering. I did my rowing machine, got my workout in. I did a little bit of stretching, I didn't eat until 1:30 p.m. So I did intermittent fasting for like 18 hours, ate a super healthy meal. I had stir-fried vegetables and some lentils in farro, and it was like super healthy, all organic, no fat, super clean food. And then I did another little workout right before I started this class here, because I just like 5 minutes, with the weights just to kind of get myself perked up. So there's a fair amount of work that you have to do just to physically take care of yourself. And the better physical shape you're in through exercise, through good emotional connections with your friends and family, the longer you're going to last in practice and the more you're going to help patients. And then the third P up here, it's practitioner, patients, and practice, is then putting also equal amount of energy into your practice itself, into the operations and logistics and accounting and the front end and the back end, and making sure your phone is answered well and making sure your website is up to date, and not having a 20-year-old bio on your website, but taking the fresh pictures every few years of yourself, and keeping everything attending to the needs of your practice. And what we really hope for is that for successful practices, you've got equal attention to your own self-care so you can be fit and do this for a long time, to taking care of your patients, which is why we're all doing this, and then to the logistics that run this operation, which is the practice. And most practitioners are pretty biased in that they're spending almost all their energy focused on patients, which is where we should be. But if you neglect yourself or you neglect your business, you're not going to be able to do this for very long, right? As long as you should be. So on your side, on the practitioner side, are you living a healthy life? Is this work meaningful? Do you feel like you're contributing? On the practice side, is the practice, the business supporting you and being sustainable and something that's profitable so that you don't have to panic all the time, but you feel like you're getting somewhere professionally, right? And then on the patient side, that you're getting the results that you want with your patients, the life-changing results that we really have come to expect from a functional medicine program, okay? So those are the 3 Ps you want to keep in mind. So I created some new things for you guys here, models of practice building using labs. And so, it's not new, it's just new that I have this on slides, but it's sort of a summary of what I've seen having coached thousands of doctors over the last 20 years or so. What have I seen work? Niche practices, longevity clinic idea, and then chronic illness, all right? So this, let's start with this first. We'll work up to the other stuff. So a niche practice can be super successful. We have this one student, Anita, she's a medical doctor. She took my mentorship maybe 5-6 years ago, and she left her conventional medical job and she just wanted to work with diabetics. That's what she wanted to do. And I was like, more power to you. So she set up an office and she just works with people who have diabetes. There's a lot of people with diabetes. It's a big problem, right? And so what a wonderful thing. And she's into vegan diets. Great, more power to you, Anita. And so she puts people on vegan diets and she does all the lab testing, like the GI maps and the organic acid stuff and omics, and then, is basically reversing diabetes faster than she can do anything else. So that's, I don't know, that's a pretty satisfying niche. We have another good friend of mine that I've known for a decade or two. When she started her practice, she just went into complex GI cases, just GI, that's all she does. You got to have a GI problem if you're going to talk to her. We have practitioners that do men's health, brain health, mental health, brain health, just work with athletes, just work with executives. So as you're thinking about this, you may want a specific niche practice. And if it appeals to you, I think it's really in some ways the easiest model to be successful with, because you get so good at men's health if you do men's health, that after a few years, you're an expert. After 10 years, you're like amazing. And you just build on this one theme. And that can be, in some ways, the easiest, most successful kind of practice. Something that's becoming more and more popular now I'm seeing a lot of practitioners move into this direction of longevity and the whole forever young. I want to anti-aging. We used to call it anti-aging. That's kind of like more of a pro-aging approach, where aging gracefully, aging in a happy way, aging, reversing the effects of aging and biological aging, lowering your biological age. This can be a great model, and it's really what I'm working with on my practice now. Preventive programs using lab-based supplement protocols and lifestyle changes. So a lot of practitioners that do this include the genetic testing. I'd say most of them include genetic testing because that's of great interest to people in this category. Some of them are doing executive health, working with extremely well-off people. One of our graduates that I talked to recently, one of the Kalish Institute graduates, is working at a sort of executive health place, and she's something like $87,000 a year. People paid his fee to get access to all these healthcare professionals. It's like a concierge level program, but kind of as high end as you could possibly go. You may want to work with the whole biohacking community. Those people are out there trying to figure out their own stuff, and maybe they could benefit from a little bit of lab work to give them some rational thinking processes. And then we look at the standard model for functional medicine in the 30 years I've been involved, which is the chronic illness model. And so working with complex chronic illness, it's what I've done most of my career. Lyme, mold, advanced cognitive decline, chronic fatigue, mental health problems, autoimmune problems, recovering from cancer, recovering from a heart attack. The list goes on and on and on. Kids with ADD, ADHD, autism, older adults that are depressed. And I've been in the trenches in the chronic illness model for a really long time. I just come out of it about a year ago, June. And I can say this is a hard way to go, although it is very, very rewarding. But I just want to point out it's not the only model, even though it's a commonly adopted model. And the burnout rates in the chronic illness practice model are extremely high. Burnout rates in a longevity clinic type model or wellness model, not high. And in a niche model, not high, okay? So if you're gonna do the chronic illness model and work with people who are quite sick, then you gotta be extra careful to take care of yourself and those kinds of things, okay? So now, I think the essential question I want to try to answer today is the value of labs. How do you establish the value of labs, okay? And in a paradigm that we're all familiar with, if I walked into my regular doctor and she said, I don't know, Dan, it kind of looks like you have high cholesterol. I think you should take a statin. Would I do it? I'd be like, no, nobody would do that. Nobody would take a cholesterol lowering medication. You would say, I want you to test my cholesterol, I think, first. Isn't that usually how this works? And then if you had high cholesterol, certainly most Americans who have very high cholesterol end up taking a statin. And that kind of makes sense to our mental construct of how we have come to understand the use of medications and prescriptions, and that there's a test. And okay, you have high blood pressure, now you take your blood pressure medication. It's not just that your doctor has this intuitive feeling that that's what's happening. So if you extrapolate that out to what we're doing here, you want to have a test for every single thing that you're going to recommend for that patient. And believe it or not, if you run an omics test and a GI map and maybe a food allergy test, you have plenty of things to talk about, okay? So you want to have a test so that a person can improve their digestion and absorption. You run the GI map. You want to have a test so they can improve their metabolic function and neurotransmitter function. You run the omics, right? Having that test is the critical difference between success and failure, because the test will tell you what's wrong specifically, so you can be very targeted in your treatment. And the test will motivate the patient, because the patient will see what's wrong. It's not your personal opinion. It's not like, wow, it looks like you have high cholesterol. It's like, whoa, this test shows that you have H. pylori. Stomach pain, well, H. pylori kind of adds up. Maybe we should go after that bug that we just found on your GI map. Okay, so making sure that you understand the value of the labs and that you're able to communicate that to patients, that this is the way that you can really find hidden problems that are just not going to leap out and knock you over. It's very difficult to just look at someone and see if they have H. pylori or not. And the test will show you immediately if that's happening. And then I've also, from just maybe a more theoretical perspective, see labs as the critical step, not just because we get amazing clinical results, because that's really what functional medicine is. It's the unique selling point of what we're doing is that we can run these functional assessments. And without the functional medicine labs, you're practicing lifestyle medicine, which is an absolutely legitimate thing to do also. But I think there's more. I think, why would you do lifestyle medicine if you're able to run these tests and see all these details about someone's blood sugar response or someone's gut microbiome? I mean, getting that data, as I said in the beginning, the direct quote from Dr. Timmons, that your protocols are only as successful as your lab data. And of course, you can do the lifestyle coaching, and you should do the lifestyle coaching, but it's really the functional testing, I think, that differentiates and makes functional medicine so special. Now, there's also like a motivational thing, and I just went through this myself, and so I can talk about myself now, because I'm seeing this doctor, and he's a functional medicine doctor, and he had me do these labs, because he's like, I don't know what's wrong with you. We should do these tests. So I said, I'll do these tests. And so when I did these labs, and they came back, the lab results came back, I was really raring to go to start a supplement program, because I talked to Dr. Gio. He told me these are the lab results, this is what you need to take, and it all made perfect sense. Then he also said, Dan, based on these tests, you're going to have to really crank up the high intensity exercise a little bit and lay off the bicycle, because I like to ride my bike for a couple hours a day, and it's like, oh, no, you're not going to do that anymore. We're going to go high intensity, shorter workouts, not forever, but just for a little while. So the lab not only got me motivated and excited about doing a supplement program, which, by the way, started to help me within like a week or two. It's been a great experience. But then the other thing that happened is that I was like, okay, I got to change my workouts, got to lay off the long bike rides, do these shorter, harder workouts. The lab test kind of forced me to see that I needed to change my lifestyle factors as well. And it wasn't his opinion about what I should do. It's just like, yeah, the lab shows this, and that means you need to do that. And so by investing in the labs, me spending the money for the test, getting the advice from the doctor, that's what made me do the supplements and the lifestyle changes. And of course, within a few weeks, I started to feel tremendously better. This was about 6 months ago. And I just did a retest like last Friday. I'm waiting for the results to come back. I'm super excited about the retest, because it's one thing to get a test that's screwed up. It's another thing to get a retest done and you're like, whoa, I've gotten that much better. So I'm pretty psyched. And I know the lab's gonna be better because I feel so much better, but I don't know if I'm like 50% better or 75% better. So same thing with these GI map and omics tests. The first test is very important, but what's really important is that you do the follow-up testing. Now, if I had talked to that doctor and he had just said, I don't know, Dan, we're on this Zoom call, kind of looks like you need to do high intensity exercise, kind of looks like in the background, maybe he saw my bicycle. It looks like you're taking bike rides. Throw the bike out for a little while. If he had said, well, it looks like you probably need these supplements, and I don't know, it makes sense to me. I read about them. I wouldn't have done any of it if it had just been his personal opinion. The lab is what created all the motivation. Okay, and his ability to interpret the lab was really what made the difference for me in terms of kind of, what would you call it, endorsing his program, or accepting his program, or enthusiastically, wanting to get involved in the program. It was the lab test that created all that value for me. And you could probably wing it with a supplement program without a lab. I don't think it'd be very good. And you could kind of wing it with lifestyle changes without the lab. But why? Just doing a test for a couple $100 that gets all these changes in place makes a huge difference. And you get all the lab data so that your program's, going to be effective. So now, when we're talking to patients about the lab testing and why they should do it, you just have to realize a little bit about how people make decisions. So people make decisions based on their emotions, purchasing decisions, and then they rationalize later with logic and intellect. So all decisions to purchase things or to change your life in some way are emotionally based. So don't do what I did in the beginning, in my first few years of practice, which is explain the logic of the lab. You really want to sit down and say, look, this beta glucuronidase thing is really important. And let me tell you, people don't care about the individual markers and the logistical issues and the science and all that stuff. If everyone functioned that way, everyone would do every lab every day. We'd all be testing ourselves all the time if it was logical, but it's not logical. You have to really communicate with people on a feeling basis so that they see and understand your excitement They see that you understand the value of the test. They see that you're going to get this information that's not obtainable in any other way. And then all of a sudden, the cost of the lab seems like a bargain. And if patients are not enthusiastically endorsing the idea of getting tested, then they're not understanding how important this is on an emotional level, and on a sense of urgency level. And, once you've had enough of these cases, like the 2-year-old kid from this morning is a great example. Once you see, that's the thing I told the doctors in class. I was like, because there's like maybe 15 doctors on this call. One of them's presenting this 2-year-old. And I just stopped everybody and I said, listen, this should make all of us on this call want to test every kid that we can. We need to understand the benefit of these labs and how life-changing they can be for people. And once you understand that concept, explaining them is quite easy, and then people will want to do the tests. And so in terms of misunderstandings and where people get tripped up, thinking that the tests are too expensive, again, like what was this test, the value of this test for that 2-year-old's family? Incalculable, and certainly, so the amount of money that people are actually spending on the lab tests, it's a total disconnect between that and the real value. The real value is so immense, it's sometimes hard to explain. Like, what's the value of a woman who's struggling to get pregnant, getting pregnant, or the value of this family with the 2-year-old seeing that their child's not in pain anymore? These are things that almost don't have monetary value. They're so valuable. And so once you see some successful cases, you'll realize, yeah, everybody needs to do this test because the value is there, right? The purpose is really so strong that we need to get everyone to do these. It can be a little scary and intimidating to order a test. You don't know really what's going on necessarily. And I certainly went through many years of generalized anxiety around doing this. But again, if you quickly order like 5 of them, just get 5 of them done. It doesn't even matter who, just find 5 people that'll do the test. You get the results back, you interpret them. We have tons of classes for that, by the way. You can call the lab also, talk to them. You get them interpreted, and then you'll see results, and then you'll have, the confidence to explain this to people and how important it really is. Now, it's kind of obvious that if a person has a digestive problem, you should do a digestive test. But where this gets a little confusing is, why would you do a GI test, organic acids or omics, food allergy testing? How do they relate to one another? And that takes me about a year to explain in class. So I don't think we're going to be able to cover that. So I wanted to give you some take home that you can just do now. The easiest way to deal with in the beginning year or two when you're learning this work is just run a GI map on everybody. I know that sounds a little wackadoodle maybe, but if you do that for 10 or 20 patients, you'll see what I mean, because you will get people who don't seem like they have any digestive problems, and you'll find that the bulk of their depression was coming from a GI problem, or people that have anxiety, and the anxiety was coming from a GI problem. We had a patient recently, low back pain. I would have thought it's coming from the gut. Well, it was. When the gut was balanced, the low back pain went away. So it's very difficult to tell who needs a GI map and who doesn't. So we just test everybody, and I don't think, once you do that for a while, you'll be really glad that you're doing it. Okay, then as you get more advanced, you can do the omics test or organic acids test. As you get a little more, maybe you've done 20 GI maps now, you want to kind of branch out a little bit. And then for sure use the IgG Food Explorer testing when you want to focus on diet changes, because that's a great way to motivate, get people motivated to do, make diet changes. And also a great way for you to get more specific on what you want them to do. And then learn one test at a time. Just start with a GI map. It's a good place to start. Ultimately, you're going to need to understand hormones and other stuff too, but a GI map is a simple, easy way to get started. And then I just sat down and did like a little brainstorming session on reasons to do a GI map test. Now, some of these are obvious. If you have GI symptoms like heartburn, bloating, constipation, diarrhea, that's kind of obvious. If I went to see my regular doctor and I said, I have heartburn, bloating, constipation, and diarrhea, and she said, oh, well, we should do this GI test, I'd be like, oh, I'll do that. But if I went to see my regular doctor and I said, oh, I have this really bad back pain. I don't know when it started. It started around Christmas time. And she said, oh, well, we should do a GI test. I'd be like, that doesn't make any sense. Don't you think you want to do an x-ray or something? So in order to explain why someone with some chronic inflammatory back pain related problem should do a GI test, you have to be able to explain how the gut is related to whatever the condition is that that person has. So if a person has fatigue, for example, you can say, well, when the gut is inflamed, one of the things that happens very predictably is the adrenal hormones get out of balance, and that creates fatigue. In fact, we're going to measure SIG-A on this gut test, and that's a measure for how well cortisol is working indirectly. If the person has depression, you can talk about, oh, well, I know it seems a little odd that we want to do a microbiome test, but there's something called the gut-brain connection, which is incredibly powerful. And if your gut is inflamed, it can elevate these things called cytokines, and that can decrease your serotonin levels. If the person has an immune problem, well, I know this seems a little wacky, you don't have any GI issues, but the gut contains more than half, maybe 60+% of your immune system. And if you have a hidden gut problem without any gut symptoms, that could trigger an issue with your immune system, and so on and so on and so on, right? So for each of these conditions, you can start to work out a dialogue. Weight gain is an easy one, right? Because, you're overweight, you want to figure out how to lose weight. Well, there's a ton of research, and you can look this up and hand out some studies if you want to patients, about how commensal bacteria, the good bacteria in your gut, regulate your metabolism. Can you believe that? It turns out that your gut microbiome is a very important determinant of your weight. Okay, so for each condition, you want to be able to describe why the test makes sense. I also find that the testing can be, if you use it right, the biggest motivator to drive the lifestyle coaching. And functional medicine has always been 80% about lifestyle coaching. But how do you get someone to change their diet? It's not easy. How do you get someone to sleep better, go to bed on time? It's not easy, right? So as a simple example, if the GI map comes back with a yeast overgrowth, you can say, this is not good. You have a yeast or fungal overgrowth. What does that mean? The person's looking at you. Well, for one, we have to change your diet. You have to stop all sugar for at least 2 weeks, maybe for longer. So right off the bat, one of the best things you can do for every patient, right, is to get them to stop eating sugar. If they have a positive Candida marker on their GI map, there's your ammunition right there to make that happen. And so each of the markers, if interpreted well, like for example, let's say that they have, one of the markers related to digestive enzymes is off. Then you can say, oh gosh, your pancreatic enzymes look like they're a mess. Oh, what does that mean? Well, when you're stressed and you're eating, you don't make the amount of enzymes that you really should. And we can see on this lab that your enzyme levels are low. So we got to really talk about de-stressing, taking time to eat meals, chewing your food carefully, doing all the right things so you're hydrated and you're not getting dehydrated. So you can use each one of these markers to drive the lifestyle coaching. And that makes the lifestyle coaching quite a bit more impactful. You're much more likely that people will do things when they see that there's something wrong with the lab and that you're making a recommendation based on the test. Okay, so these are slides that I put together to show you how I try to explain the test to people. We'll look at some sample tests in a minute. And as you all know, probably, they're complicated. Like it's hard to even pronounce everything on some of these labs, right? Like Akkermansia mucinophila, that's kind of a hard one, And so simple explanations for you to use with patients will allow you to communicate more effectively. And in general, I found that most people want a simple explanation so they can understand what's wrong. So I have it divided, that's the word. I have it divided up into 3 different stages. And not very creative here. It's stage 1, stage 2, stage 3. So stage 1 means there's a microbiome problem. Something's happened that's thrown off the microbiome. It could be related to their diet. You can see where this is going, right? It could be related to sleep. There's a study about sleep fragmentation for 4 weeks increases food intake, right? And so, and it could be from stress. So is this making sense? You see where we're going with this? So diet affects the microbiome. There's a study on that there. Sleep affects the microbiome. There's a sample study for you right there. And then stress affects the microbiome. So if you see the markers on the GI map that relate to the microbiome being out of balance, you can say, gosh, your microbiome's not looking very good. And they're like, well, how do you know? Well, look at the test. You can see all these commensal bacteria are low. Well, why would that happen? Well, let's talk about your diet, sleep, and stress and how they relate to the microbiome. And if you can do that, you can motivate people to go to bed at 9 or 10 at night, to clean up their diet and get rid of all the foods that are screwing up their microbiome, and get them to start to eat vegetables and fruit and all the good stuff that you need. And then get them to de-stress, to meditate or play golf or do whatever it is, gardening, that's going to get them de-stressed. That is what I call labs to lifestyle, right? Where you're seeing the lab positive results in the microbiome, but then that's allowing you to motivate the person to get into the lifestyle changes. There are, of course, supplement protocols that go with each of these things too, and I'll get into those when we look at the sample labs. But I just want to talk about conceptually, because 80% of functional medicine is lifestyle change, which means 80% of the time you spend with patients is coaching them how to make changes. And if you have the labs and then you're doing the lifestyle coaching, it's just so much easier for you to motivate them to make the change. And I think we're all the same way. We don't really want to change unless we see there's a reason that we have to, you know. And once you have to change, then, you know, the whole process just gets accelerated quite a bit. So again, healthy lifestyle, you have a diverse microbiome, a resilient microbiome. Unhealthy lifestyle, your microbiome gets screwed up. We want to measure this on the test. We're not saying, I'm going to look at you and say your microbiome is screwed up. We're measuring this on the lab. And that is in the commensal bacteria section of the GI map. Okay. Then, and we'll look at some sample tests in a minute, I promise. We'll leave time for that. So there's organic acids. So DSL Lab also offers organic acids and an omics test. The omics test includes organic acids, but it's quite a bit more complex. And this I just want to mention because I think for all of you, eventually you're going to want to run organic acids or an omics on every patient too. That would be like the next step once you get the GI part down. So I just want to kind of present this, and maybe someday in the future we can do just a full hour on this subject itself, okay? In fact, I've done a full hour on this in the past. If you look in the older videos, you'll see some stuff on this. But there's 4 key areas: metabolism or mitochondrial dysfunction, brain or neurotransmission, detoxification, oxidative stress, and then GI dysbiosis, yeast overgrowth. So organic acids and the omics tests, those are the key areas you're going to be looking at: mitochondrial function, brain, detox, and GI. And so if the patient has problems in those areas, it's something to consider to do the additional test, right? And these tests are so much more complicated to interpret. They take, you know, at least 6 months to a year of pretty intensive training. But you should at least have some from today, just a general introduction to how these things work. So with organic acids, you can look at it as a nutrient assessment test. I mean, that's kind of like the lowest level. Oh, you're low in B6. That's what the test shows. You need B6. All of a sudden, person, you know, gets healthier because they're taking the right vitamin. You can look at it as a personalized nutrient protocol development tool, meaning that you want to do personalized nutrition in your practice. You want to have patient-specific programs. You run the lab, and you can recommend what nutrients they need that are very specific just for them based on the test. You can use it as a wellness assessment, like we were talking about earlier. You're worried about heart disease. Gosh, you have high oxidative stress. Let's knock that down, retest you, and keep you well. I use it in my practice as a yearly test, you know, once a year kind of health maintenance checkup test. Has always been organic acids. And I have patients that have been doing organic acids once a year for a decade or more. It's so great. If you see 10 of these in a row over the course of 10 years, you'll learn everything you need to know about that person's biochemistry to keep them healthy. I promise you that. You can, and historically, these tests have usually been used for chronic illness assessment for people that you're just not really sure what's going on, but they're super sick. The autism treatment community uses organic acids, sort of classic test for kids with autism. You can use it in a cardiovascular oriented or metabolic health oriented program if you're doing like obesity treatment protocols or you're really focused on healthy heart kind of thing. They offer a great genomic assessment, different than the typical SNP testing, and you can combine it with other genomic testing too, which can be a really great combo. That's like super advanced. That's like extra advanced, but there's people using it that way. You could use it just to figure out if a person's eating a healthy diet or not, a longevity assessment, disease prevention, cancer, heart disease, diabetes, cognitive decline. You can see these diseases miles and miles away, and this test will show, oh, you're burning through your dopamine pretty fast. You know, that could lead to cognitive decline in your 80s. I know you're only 35 now, but maybe we should address this, right? So lots of prevention you can do with these kinds of programs for all the different diseases that are quite debilitating: heart disease, cognitive decline, cancer, diabetes, spotting the precursors to these problems decades before the actual disease shows up. Okay, super important. So I talked about this a lot already. Labs to lifestyle. I forgot one little thing though, the second bullet point there, which is that the GI map includes a marker for gliadin, which lets you know if the person is sensitive to gluten or not. So that's a great one, because if they're sensitive to gluten, they need to go on a gluten-free diet, and you don't have to get all up in arms about it. You can just say, hey, the lab is not my problem. I'm not imposing gluten-free on you. The test is saying that you have this gliadin marker that's positive. So we need to, pull you off the gluten for a little while here. And then chemical exposure. I find a lot of people we do the omics or organic acids with, if they have a liver detox problem, first thing we want them to do is stop caffeine, stop sugar, and stop alcohol. I mean, a lot of people are drinking way too much alcohol, especially these days. There's so much stress in the world, So anyways, testing can really help you with getting people free of the chemicals, alcohol, caffeine, sugar, all that junk that people are doing that really screw up their liver. And then you can also, I mentioned earlier, candida test can help people get off of sugar. I'm really all for having people stop alcohol for a few months. I'm not against drinking, period. But you want to spot who are the people in your practice that are alcoholics and make sure you pull them off of this stuff. So here's some sample. We're going to look at some sample labs in a moment. So there's the omics and also regular organic acids that are offered. The GI map, so the flagship for the lab company. They also have the IgG workups if you want to look at foods. Okay, IgE if you want to look at foods. Cytokine response profile, and then the genomic insight one if you're really deep into this work, and that's sort of extra advanced for those of you that really want to pursue that. And just to mention before we get to the labs, we have our Business Essentials Bootcamp starting in February. If you're interested, you can get 20% off if you use the code DS23. So now, we talk a lot about practice building using labs. And I have to just look back on, if I could look back at myself in 1992, I read about this doctor in Boulder, Colorado in 1992, and he was doing something called integrative medicine. Functional medicine was just barely developed as a term, but he's basically doing functional medicine, and he didn't call it that. And I read this magazine article, and I was like, I want to do that. I didn't really even know exactly what it was, but I just wanted to do that. And so I've had a passion for this work for over 30 years, and 97% of my success has been based on my ability to run and interpret labs. I'll give myself credit of like 3% for my personality and I don't know, my good looks, or I don't know, whatever, that's a joke. But I don't know, people are attracted to me because I'm a nice guy or whatever. But 97% of my 30-year success has been based on being able to order and interpret labs. And I have trained hundreds and hundreds of doctors and watched the exact same thing happen. Okay, and it doesn't matter if you live in Duluth or if you live in New York City or if you're in Alaska. We have all these practitioners in Alaska now. It doesn't matter if you're an acupuncturist, chiropractor, medical doctor, nurse practitioner, osteopath. You can be super successful if you learn how to order and interpret these labs, okay? So let's just do a little taste of interpretation here so you can see this particular case. Let's see. C. difficile. There's a GI map, obviously. It says GI map everywhere. You can see H. pylori, but it's not quite at the threshold for a positive. Some people treat that, though. And then here's a section that's super important, which is the commensal bacteria. Okay, that's the microbiome portion. and then opportunistic bacteria right there, Candida overgrowth, and then a little bit more in the parasites. So there are these 3 stages I mentioned. I didn't cover them all, but the 3 stages are really simple. Stage 1 is a microbiome imbalance. We talked about lifestyle plays into that. Stage 2 means there's a problem with one of the organs, one of the GI organs is dysfunctional. Okay? And then stage 3 means there's a pathogen. So stage 1 is microbiome, stage 2 is a GI organ, stage 3 means there's something you got to kill. So when you're looking at the lab, I was just looking for those 3 things. And the first thing you look at is the microbiome. And so it's easy because you go to this page here and it says, wait a minute, sorry, I passed it. Maybe it's not as easy as I thought. There, it says commensal/keystone bacteria. So this is a roadmap to your microbiome. And in this particular case, a couple of these markers are low. Sometimes you'll see most of them low. Sometimes you see most of them high. Anyways, this person has an imbalanced commensal bacteria marker section thing. And this person then has a microbiome problem, which is what I call stage 1. Okay, and then there's specific things you can do to treat stage 1. Stage 2 would be an organ-related issue, and you'll see that at the bottom of the lab here under intestinal health. Steatocrit is your gallbladder. Elastase 1 is your pancreas. The immune response for SIG-A and all that stuff, that's more like small intestine. Some of them are large intestine. It's just basically, let's say, inflammation and damage to the immune system in the intestinal tract. So you can tell right off the bat from these labs, is there a pancreatic enzyme output problem, a gallbladder related problem, or something to do with what we call leaky gut or an inflamed gut. And if any of those are present, then you can treat the organ that's involved. Treat the gallbladder, treat the pancreas, treat the leaky gut. So that's a stage 2. So stage 1 is the microbiome gets disrupted. That goes on for long enough. The organs start to get involved. And then stage 3 would be some kind of overgrowth or a pathogen. In this patient's case, Candida overgrowth and some dysbiosis. And I think they had a little bit of C. diff. So then when we're designing a program, we want to have a program that and we're addressing these 3 stages. And let me write them out for you. Stage 1 is microbiome. And that's the commensal bacteria. The person had some that were low. Stage 2 are GI organs. And there's not an infinite number of these, right? It's gallbladder, pancreas, and intestinal tract. And then stage 3 is a GI bug or a GI pathogen or a micro antimicrobial, let's say. Maybe it's an easy way to put it. It covers all of them. Antimicrobial program required. And that could be for C. diff, H. pylori, yeast overgrowth, dysbiosis. Antimicrobial is kind of like covers them all, right? I use the term GI bug because that covers everything too. But some of these bugs are parasites, some of them are yeast, some of them are bacteria, a lot of different options. So with this particular lab, you can see they had a microbiome problem, yep, because the commensal bacteria were off. Did they have a GI organ problem? Let's go look. Yes, SIG-A is low, so they need some restoration of the gut lining repair system. I mean, the gut immunity, right? So I would say for this particular patient, stage 1 was a yes, low commensals. So you want to design something for that. For stage 2, they had low SIG-A. So you want to do something for the immune response in the gut. Needs to be upregulated. And do they have some pathogens? Well, they had like more than we can remember, right? So they had C. diff, ouch, yeast overgrowth, we call Candida, and dysbiosis. So in this particular case, you have all 3 of these stages present. The microbiome's not doing well, the GI organs aren't doing well, and there's a bunch of bugs to kill. So then this is a point where you take a deep breath. I don't really drink alcohol anymore, but if I was a drinker, I would have a sip of my martini right now and just try to relax a little bit and think, okay, what am I going to do? Because all three of these stages are present. What am I going to do? Well, what's the whole point of this talk? First of all, 80% of this is lifestyle related. So right off the bat, we're going to say, well, what could we say in terms of lifestyle? Well, the microbiome is not doing well. How do you improve the microbiome? There's two ways: polyphenols, and fiber. You can get the fiber you need from beans, black beans, pinto beans. Lentils are supposed to be the best. Doesn't really matter. In the beginning, have people take small amounts. Eventually, we should be consuming half a cup to a cup and a half of beans every day. That fiber from beans will feed the good bacteria and bring those commensal bacteria back like nothing else. Polyphenols, famous polyphenols, cranberries, blueberries, pomegranate. Those polyphenols in those foods are large molecular structures. They can't get across the gut lining into your bloodstream. You know, and this kind of pisses me off when I learned this, because the first thing I thought of, this is kind of weird, but the first thing that I thought of was, I just went to the farmer's market and I spent like $16 on a pint of blueberries. It's like, because they're really expensive at the farmer's market, you know, but I buy them anyway, so they're good for you. And then I found out that those polyphenols, they don't get absorbed by the human gut. So why do we eat them? Why are they so good? Because they feed the good gut bacteria. The gut bacteria can live on them, we can't. So all those blueberries I've been eating my whole life, and pomegranate and cranberry, all the polyphenols, green tea, wherever you get your polyphenols, for the most part, those are for your good gut bacteria. So lifestyle-wise, you want to do something for the microbiome. You increase polyphenols, you increase fiber. Stage 2, what was the stage 2 problem? Oh, low Sig-A. So low Sig-A is a weakened immune response. And Sig-A is under the direct control of a hormone called cortisol. So you need to get this person to de-stress to boost their Sig-A. Because again, secretory IgA is under the direct control of the stress hormone cortisol. So polyphenols and fiber for the microbiome, de-stressing, meditation, whatever it is, for the Sig-A. And then the stage 3, oh, conveniently, this person has a candida overgrowth. So there we go. What are we going to do for the diet? We're just going to cut out sugar. No sugar until we get this candida under control. Can I eat fruit? I can have like a piece of fruit a day, but not a ton, you know. We can have your blueberries for sure. That's not a problem because that's good for your microbiome. So now we've got 3 lifestyle changes: polyphenols and fiber from the diet, de-stressing, some meditation for cortisol because Sig-A screwed up, and no sugar because of the candida marker. Now you're using the lab to generate the lifestyle recommendations. See how it's this is the labs, the lifestyle thing. It's kind of making sense. Now, I am personally very interested in supplement programs. So I give everybody supplements all the time. There's some doctors that just do the lifestyle stuff, which I totally respect. I think it's harder. You have to be better to do that. Doing the supplements is kind of like cheating because it helps people so quickly. So now in this case, well, we're going to cover the low commensals with the diet, so we don't have to worry about that. But we got to kill the yeast. So I usually use oregano oil capsules, a couple of those 3 times a day. And then depending on what company you like, there's GI Microbex. I use Designs for Health a lot, which is a broad spectrum killer. Say maybe do 1 of those 3 times a day. Something like that, simple, basic anti-candida program for 2 months to knock out the yeast overgrowth. That may also take a pretty decent swipe at some of the dysbiotic bacteria too, okay? 2-month program there. And then on the Sig-A problem, the low Sig-A problem, I would probably do an adrenal lab or do an omics test and look at the stress compound, the stress metabolites for the catecholamines, you know? This is not spelled right. Okay, and we have time. Just one more real quick couple minutes so you can get another lab. Let's see here. You get a taste of what we're doing here. Here's another GI map, 59-year-old. Oh, okay, so the commensal bacteria, first we look for the microbiome markers. Well, that's kind of obvious. And we see labs like this all the time in my training programs. I mean, so many people have this problem. So now you know right away, oh, polyphenols and fiber, that's gonna fix that. You could use probiotics too if you want, but polyphenols and fiber will take care of that over time. It takes a little while, obviously. And then we're looking to see there's some dysbiosis, some dysbiotic bacteria, and anti-gliadin is high. Well, now you got to slam dunk on your lifestyle because that's a gluten-free diet. So anti-gliadin being high indicates sensitivity to gluten. So now that's going to probably take up a couple of months of your coaching time to coach them through getting off of gluten. There's also some inflammation with the zonulin being high. So dysbiosis, a really bad commensal. So this is a good example of what can happen if the microbiome starts to really fall apart, okay? Look at one more before we wrap up. Oh, a small amount of Giardia, not enough to trigger a result there, a reference range result. I still usually treat Giardia, even if there's a small amount. I've just seen, usually with the herbal program, I've seen so many benefits to getting rid of Giardia. Even in a small amount, it seems like it shouldn't be present. H. pylori, quite high. That would be probably take precedence over the Giardia, which was there, but not officially a high marker. So you want to go after an H. pylori program. And now when you get bugs like that, you probably need to just do some killing for this one. There's some dysbiosis present. So this would be a protocol where you'd want to do some lifestyle changes. And let me just show you real quick what a program would look like. You'd want to do some lifestyle changes first, right? And then you'd want to do 1 or 2 months of the lifestyle changes, kinds of things that we already talked about, getting gluten-free and all these things. And then you'd want to go after the H. pylori, either with antibiotics or herbs elimination protocol. And I haven't found great results. I mean, I think if you do the microbiome work and polyphenols and fiber, that's probably not going to get rid of the H. pylori if the person's really sick. So this kind of situation, when there's a real pathogen you got to get rid of, you want to start with what I would call the stage 3 protocol, right? Where you're going after the pathogen first. Clear this first. But you want 1 or 2 months of a de-stressing, good diet kind of program in the beginning to get that knocked out. And again, if you want to use Designs for Health, they have GastroMend, which is designed to clear out H. pylori. Give a couple of those with each meal. You can also toss in something like deglycerated licorice root, or maybe something like their GI Revive would help. That'd be like 1 scoop 2 times a day to have a more anti-inflammatory effect. But you can definitely clear out H. pylori with the herbs. You could use antibiotics also if the situation warranted it. Okay. All right. And I appreciate your time. Thank you very much. And I look forward to speaking with you or seeing you at the next one of these. All right. Take care, folks.
Thank you very much, Dr. Kalish. We'd like to thank everyone for attending today's webinar. For more information about test offerings by Diagnostic Solutions Laboratory, please visit diagnosticsolutionsLab.com. Thanks again, and have a great day, everybody. Goodbye.
Bye now.